जब बारिश में साथ हो मन
Hi everybody, welcome to PW MedEd. My name is Dr. Datta, and today I am your psychiatry faculty, but today is actually about celebrating someone who has been a phenomenal star for the FMGE batch, and I'm going to invite him shortly. Not only are we going to talk about his success story, but we're also going to try to get the secret sauce from him. तो अगर आप FMG हैं ग्रेजुएट, और अगर आप समझना चाहते हैं कि हाउ टू get things done and how we at PW MedEd are also constantly trying to make this so easy for you, then this is the right thing to watch. We'll keep it quick, we'll keep it very precise, and we'll keep it interesting. अगर आपको कुछ पूछना है, please drop a question. It's always good to have questions from your end for our wonderful star. Hi, Dr. Mukesh Sharma. How are you today?
Hello, ma'am. I'm doing very great right now, and I'm feeling so happy to interact with you. And good evening, ma'am.
Good evening. Thank you so much. Zoom on करिएगा मुझे देखना. Right. So this is Dr. Mukesh Sharma, our lovely FMG star for the moment. And Dr. Mukesh will tell us which medical college he went to, which batch he went to, first of all, please.
Ma'am, I went to Ukraine to pursue my medical education, and I graduated from Zaporozhye State Medical University. And basically, I hail from Hyderabad, Telangana State, from South India.
Excellent. And how much of your batch was online and how much was it in person because of the whole pandemic bit, of course?
Yes, ma'am. My entire course duration was offline, ma'am. But during COVID, as the rest of the world was also facing the same challenges, we went a bit of our course online, but then we had that supplementation of offline and practical classes, ma'am. So it was like mixed, hybrid, ma'am.
Okay, excellent. And how is the experience studying in Ukraine in your college? If somebody is considering your college, what are the, don't make it too negative, but what are the actual perks of going and studying there? And definitely what are some lacunae which our Indian education system may have for that matter, which are good?
Yes, ma'am. I must say that that is really an interesting and very important question right now, because when I was going to Ukraine, I before going to Ukraine, I had many other universities and countries in my mind, and I was just exploring. And as you know that during COVID and after Geo Revolution, everybody got into the internet stuff kind of thing, and they are just googling everything. But before that, it was not that predominant, but still it existed. But during our time, it was not that predominant of using internet resource as an option to get an expert opinion. So I have researched, and me and my family researched a lot of things. Then finally, we landed up at Zaporozhye State Medical University. As everybody say that foreign medical universities have some sort of challenges, even we had same challenges there. But the best part is like we had an Indian administrator there, Dr. Divya ma'am. So it was really helpful for us to overcome those challenges very easily. So our journey and even our rector of our university was also so kind, and he was really a person who likes to take up the challenges. And so it really helped us, I must say that. And so it was quite a good time for us. And as we were talking about COVID time and my experience that time, so I must say during COVID pandemic also, when the lockdown was announced and when WHO declared as international concern health emergency, our rector has taken up that initiative of conducting the classes right after 48 hours of that declaration. So it really motivated us as a young medicos, because he himself as a doctor taking up to the international guidelines into the site, and on ground he made sure that we have to be up for the challenges. So that really motivated us and ignited us. And coming to the real challenges, like as you also, ma'am, clinician, you know the challenges in India and abroad. the major challenges comes from the tropical and endemic diseases.
Yes.
Like compared to India, there are some diseases which are not that particular or which are not that concentrated in the foreign or abroad universities, like tuberculosis or AIDS, because
Mhm.
India being the leprosy, TB, and AIDS capital, like we know that it is very prevalent in India, and but we are still working hard to eradicate and eliminate them. But as foreign medical graduates, we had some challenges in studying such
Less
topics
exposure
there.
there. Sure.
Yes, ma'am. Yes.
Mhm.
So we don't know like what are the exact clinical features or how a patient comes to us with an active tuberculosis, and
Hmm.
how will be the symptoms for a patient who has latent tuberculosis like that. And leprosy, ma'am, I must say that we just studied about leprosy, but
Ah,
we didn't even see a leprosy patient there. So I'm eagerly waiting right now after completing my FMG that I will come across a leprosy patient. I can bring some change as a doctor and I can help them heal their disease, man. Yeah. Looking
absolutely.
forward for that.
That's why it's good to have you back. And now we want to know when you finished in 2021, which attempt was this and what were you doing in the middle? What were you preparing? Were you working? What were you looking at during this period?
Ma'am, as I told you that foreign medical graduates, we are far from the grounds, like we are far from the reality. We are far from the competition, I must say, because India being a big country and with huge population and that too young population, we have huge competition. But when we travel abroad, when we go to foreign universities, the population is very less, and
Yes.
our interaction with the local citizens or local students will be very confined because we as an Indian community stay up very strong and close to each other. So we didn't understand the warmth of that competition there. But
Hmm.
still, I completed my medicine in the year 2021. Since
Okay.
then, I have given my first attempt in 2021 December. Then
Mm-hmm.
after giving that attempt, I realized that okay, being a foreign medical graduate is not that easy. Like, just like that, we can't pass this exam. And
Hmm.
I have to make sure that my ground is very strong and my roots are very strong. So I have taken some time for myself. I have been working for some good hospitals in Hyderabad, and I have
Great.
been tutoring some students as well just to check that
Hmm.
I am in good pace like that. Not for money or not just for something. I want to make sure that my understanding towards the subject is good, and I just want to be open for challenges. So I had
Yes.
taken some
Yes.
time now because when I interacted with some of my friends who completed their exam in their first attempt, they were telling me that like okay, we were grinding for this exam since our first year. Then me, I know about myself and my understanding towards the subject. So I
Mm-hmm.
lost the ground, but I still am flying. So I want to make sure that when I land in the right pathway and I land in the right airport. So
Mm-hmm.
I just make sure that I attempted all the important main videos of Physics Wala Medit, and then I attended some YouTube sessions of Dr. Santosh medicine, like Reed
Excellent.
Harrison's. Because,
Mm-hmm.
ma'am, we know that foreign medical universities, be it any country, be it Ukraine or be it some XYZ country,
Hmm.
they prefer their own literature
Of
rather than
course.
going for international literature. So
Standard.
we
Yeah.
we have less exposure of studying Harrison's, Robbins, and something like that. So after coming back to India, when we talk to Indian medical graduates, when we talk to some students who already completed the USMLE step one or step two of lab, then we
Hmm.
understand that this level of understanding they gain from is not just like from the air. It is
Hmm.
from their understanding and making their concepts clear. Then I started working on myself, like I started doing main videos, and I pushed myself so hard that I have to finish this because I don't want to give my exam just like that. Because in
Excellent.
my mind, I always had a thought like 149 is equal to 0 and 150 is equal to 300, man.
Great.
Because if I attempt, I must surely say after the exam that I'm going to make it this time. Without that confidence in myself, I just don't want to be,
So,
just
Doc, tell us your score
cheat.
this time and tell us your score the previous time.
Ma'am, in my first attempt, my score was 127, and
Okay.
this time my score was 162, ma'am.
Excellent. Wow. Great.
Yes,
So I
yes,
also
ma'am.
really like that you said that teaching others is a great way to actually remember a topic. That is so true. Now, why don't you tell us about your routine in the last few months, how you prepared for this particular exam? What would you do? Were you still working? Were you only studying? How did you manage to get to such a good improvement? And especially because this was your second attempt, what did you do different? What did a day in your life look like?
Ma'am, I will be very honest. It may sound brutal to all the young medicos and young FMGs who are listening to this, but I must say that I decided and I promised myself that I am going to give my best in this July 2024 attempt, and I'm
Mm-hmm.
going to pass. I decided this on February 27th, 2024, ma'am. That day I have taken
So
a
4 months.
resolution. Yes, ma'am, 4 months.
Okay. Mm-hmm.
I decided that day that I am going to put my blood and sweat into this uh, exam, and I'm going to give my 100% this time, and rest is up to God. But God has been so kind and merciful on me that I just gone through this exam like this, ma'am. And
You're
I
being very
coming.
humble, but also God has been kind, great. But tell us your secret sauce.
Yes, ma'am.
What, according to you, are the major do nots, and what, according to you, are the major do's when an FMG student is preparing for their next attempt?
Yes, ma'am. First, I will say because I want to say about what are the must do's. Then I
Mm-hmm.
will say about what are the things which we have to avoid. Then the
Sure.
first thing is like, ma'am, we don't. If I started my day at 7 o'clock in the morning, and I used to get all my things done, and I just to go to library and sit there. I decided that I went to Delhi, ma'am. Right now, even now, I'm in Delhi,
Okay. Oh,
and
lovely. Mm.
I'm in Gautam Nagar, the land of many medicos
Yes.
who started their journey here, life here.
Mm.
So, and I went to like I used to go to library at 8:30 in the morning. Then
Mm.
since then, from 8:30, I used to watch the main videos, man. Like the main videos only, not the rapid revision ones or not the one-liners of someone in the YouTube and all those things. The main
Mm-hmm.
videos again. And whenever I feel like I'm just running behind, then I used to switch to 1.5 or 2x.
Okay.
Then, but still, I used to follow the main videos only. And my lunch break used to be at 1:30 in the afternoon, just 40 minutes, ma'am, exactly at 40 minutes. The main
Great.
advantage is like one of my friends, they joined offline session in another institute. Then
Mm-hmm.
they used to tell me like, okay, we had our lunch break. Then I used to take the lunch break at the same time. Yes,
Excellent. You are following the
yes.
routine. Great. Great.
Yes,
Mm.
ma'am. I used to follow like that synergistic effect with them. Like
Yes.
1 plus 1 is more than two in my
Absolutely.
case. So I used to take 40 minutes of lunch break exactly. And then after that, I used to go back to library. And at 5 or 5:15, I used to have tea or coffee again. And then again, I come back and I used to start a minor subject. Ma'am. From morning till evening 5 o'clock, I used to do any major subject like medicine, OBG, or
Mm.
surgery and all those things. And in the
Mm-hmm.
evening, I used to do like FMT, psychiatry, and PSN. Like it used to be like stress buster for me, ma'am. Like,
I'm glad.
okay, like, yes, yes, ma'am. Really, I must say that.
Mm.
Because after that, in the evening, I used to do the minor subject. And after my dinner, like around 8 or 8:30, then I used to have 40 minutes break again.
Mm.
And 40 minutes break in my room. And then a 15 minutes walk in the park
Mm.
because I had a library which is located just immediately to the park. So
Mm-hmm.
15 minutes of walk, and then I used to go back to the library. Then entire session up to 2 in the night, my timing was with MCQs, man.
Okay.
I
So you
used
were
to
doing
do
your MCQs at the
MCQs.
end of the day. Great. Mm.
Yes, ma'am. And
Mm-hmm.
this I have to specially mention that I used to do a Q bank, ma'am, like
Yeah.
Q bank only because many people recommended me just to go for the PYQ sessions and PYQ Q
Mm.
bank only. But I told them no, I just want to make sure that I want to check on myself, ma'am,
You
whether
want
I'm
to know
really able to.
everything. You just don't want to do
Yes,
the
ma'am.
PYQs. Great.
Yes,
Mm.
ma'am. So I
Mm.
used to allocate my time for the Q bank session, and I used to do a minimum 500 questions a day in that time
Excellent. Mm.
till 12:30 or 1. And after that, I used to go back. I want to understand whether what I'm doing is correct or not. Then I used to go back to the YouTube channels
Mm.
and of the faculty. Then I got FMG sprint videos in Meded channel and all those things,
Mm.
which really helped me. Like that is like a Google Maps for me, ma'am. Like whether I'm going in a right direction or not, am I really focusing on high yielding topics or I'm
Mm.
just diving in an ocean? So it's like a Google Maps for me. Then I used to get my sight correct, vision correct. Okay, I have to concentrate more on the common things first,
Mm.
rather than the uncommon things. Like
Great.
when it comes to psychiatry, ma'am, our subject, like I
Mm.
just don't want to give that subject to you because you as a faculty made sure that it is our subject. So I'm saying it
Absolutely.
as our
Thank you.
subject, ma'am.
Yes.
So when it comes to psychiatry, like depression topic and delirium and all
Mm.
those poisonings and all those things,
So there
and
was a question from
antidotes.
delirium this time. I think there was a question from depression also. I'm not sure about
Yes,
depression.
ma'am.
Delirium, surely there was.
Delirium, there was a question, ma'am. And
Mm.
I think there was uh,
Alcohol
no
withdrawal,
question on.
delirium,
Yes,
right?
ma'am. Yes, ma'am.
Mm.
So I used to just go back to the YouTube sessions and I used to check whether I'm going in the right way or not. Then I used to understand, okay, the commonest things we have to go very deep rather
Great.
than going for uncommon things.
So
Then I
what are the three
understood
do
that.
nots based on the do's? You told us so many good do's that, do the MCQs at the end of the day. You had a routine. You were timing yourself very well. But what are the do nots? Because I also believe that people don't look at what not to do, which is sometimes far more important than just what to do. So what are your three do nots?
Ma'am, I will be very honest in this case also, like majority of foreign medical graduates, including me, we
Hmm.
used to have that affinity or affiliation towards easy things in our life. I must say, because it's not our mistake, ma'am, because we are not in India, we are not exposed to the competition in Indian medical colleges, or we are
Hmm.
not exposed to the importance of doing post-graduation and all those things. Our primary focus before joining medicine was to become an MBBS doctor.
Yes.
When we completed our plus one, plus two, our focus was like just to enter into a medical college. That is the reason
Hmm.
why we ended up in MBBS abroad.
Yes.
So we didn't know the ground reality. So after coming back, also majority of my friends, my juniors or my seniors, they are more affiliated towards that easy chanting kind of things and
Hmm.
one-liner kind of things, and they are just depending on all those PYQ sessions only.
Okay.
That is a major do not kind of thing, ma'am. I must say
So
that
don't
because
know things superficially only, you are saying. Deep
yes,
dive,
ma'am.
you said.
Yes, ma'am.
Great.
As you were as you were mentioning about delirium, in delirium topic also the condition of if all after alcohol withdrawal after 24 hours we will be seeing something else. After
Correct.
72 hours we will be seeing something else. And when it
Great.
comes to Wernicke's encephalopathy or Korsakoff
A
psychosis
very common
and
neat question
delirium.
also.
Yes, ma'am. And delirium tremens, all these are important DDs, differential diagnosis. We must know the concept, then only we can easily mark the right answer, ma'am.
Right.
And when it comes to the minor subjects, if we really know the answer, then only our probability of giving the right answer will be 100%. If we
Correct.
don't know, that we lose that mark. So in that case, we have to know the concept, we have to know the subject. So it not just depends on drug of choice for this is this, drug of choice for that is that. And ma'am, there was a question I must say that thiamine injection has to be given. And if we don't know the concept, why thiamine injection has to be given in
Yes.
that case, and if we just give normal saline to a patient and
Hmm.
we end up in something else. And
Absolutely. So
yes,
it's good
we
that
have
you're
to know the
pointing out,
concept.
know how to deep dive rather than skim superficially. Okay,
Yes,
since
ma'am.
I'm a psychiatrist, I'm going to round up on a fun, light note. I'm going to ask you
Sure,
rapid
ma'am.
fire free association question. There is no right and wrong. Favorite
Okay, ma'am.
subject in MBBS?
Ma'am?
Favorite subject in MBBS?
Ma'am, favorite subject for me was surgery and medicine, ma'am.
Okay, grade two. Okay. Least favorite
Yes, ma'am.
subject in MBBS?
Least favorite, ma'am, pharmacology
You
and
can say
biochemistry.
psychiatry. It's okay. I won't mind.
No, ma'am. No, ma'am. Psychiatry is a subject like knowing about myself, looking at a mirror. Because
Good.
whenever we medicals going into lots of stress, whenever we see something about depression or delirium, we feel okay, we are the depression patients, we are the delirium patients.
Hopefully not. We are
Yes,
just
ma'am.
we're sad. We're not depressed. And dream
Yes, ma'am.
branch for you. Which is your dream branch? PG.
Ma'am, yes, ma'am. For me, it is surgery, ma'am. Right now, it is surgery.
Any specific kind of surgery that you want to go on
Yeah,
to do later on?
ma'am, I want to become a
Specialization.
yes, ma'am, neurosurgeon, ma'am.
Lovely, lovely. So we have a budding neurosurgeon amidst us. I want you to finish with one motivational quote for those who have been trying, but maybe they haven't gotten through yet. Leave us with an inspirational thought, and we'll wrap this up.
Ma'am, I am telling to all the young medicals, the young foreign medical graduates who are looking up to this video right now to achieve their success in FMG exam. It's like don't ever believe shortcuts because success never comes with shortcuts. Take your time. It's okay to take your time, and it's your first time living too. This is not your 100th time, and you don't have 99 lives of experience. So it's okay to do mistakes. It's okay to do something wrong in your life, but still you have an opportunity to rectify yourself, forgive yourself, and make sure that tomorrow would be better. And one more thing, ma'am, I just copied from your TEDx talk. I must say in Kolkata, I have watched that video as well,
Okay,
and I
great.
am telling that even the darkest night is followed by the brightest sun in the morning. So today
Thank you
you
so
might be
much.
the worst kind of situation in your life, but
Hmm.
tomorrow definitely you are going to see the brightest sun. So wait for tomorrow, wait for the brightest sun, and you are going to be the sun.
Wow.
Yes, ma'am.
Thank you, Doc. I think you've really inspired a lot of people and you've inspired me as well. Thank you. This energy, keep it going, and I wish you nothing but the best. And we at PW Meded are always trying our best to be your companion, not only your teachers and mentors, but to just
Sure.
go alongside you. Thank you.
Yes,
Have a
ma'am.
great
Thank
evening.
you so much,
Thanks.
ma'am.
Bye.
Bye.